So, to meet my second learning objective, the nursing program, which is based off of communication with individuals, families, and communities, I chose to talk about my reflection of the Lehigh County Prison. I thought this was important because communication there is very different from any other place we experienced during clinical, and it helped me to think about how different lines of offense that Newman talks about, says is intra, and extra personal factors. And so in the prison, all those factors I feel are even more important than the hospital because some of them may not want to get better, and that's part of their intrapersonal. But then also conflict between different prisoners could pose an interpersonal problem, and obviously being in prison may not be the best environment for patients to heal, or if they have a chronic disease for them to manage that, as they have to follow the schedule of the prison. So there's a lot of extra personal forces that can affect the flexible line of defense for the prisoners. And through communicating with the prisoners, the nurses that go around and give meds really treat them like any other patients that they would see anywhere else, such as in the hospital or anywhere outside of prison. And I thought that was really remarkable that they put aside their judgments to treat these people in prison with respect. And they included my process recording, which was all about communication and using therapeutic communication during our first semester. And so I remember being a little afraid to go in and talk to patients, and this really helped me break out of my shell and be comfortable talking with them. And it was just asking them questions, how they were feeling, things going on in their life, just getting used to talking to other people. And then I included my discharge teaching as well as my video, because that's communication that as I become an independent nurse, I will do all the time. Educating my patients on discharge, educating them on new medications they receive, and then making sure they take their meds, because this is a great tertiary prevention of chronic illnesses. Of if you have hypertension and you get put on a medication to lower your blood pressure, we're helping you to relieve any worsening problems that could happen from that. And so Newman is saying that as nurses, we need to ensure that our patients practice their tertiary prevention, and through education, which is important to use good communication strategies, I met this objective.